Rose has spent 15 years guiding seniors through government benefits. But this year, her warning is more urgent than ever. A sweeping change is now in motion. Anyone still receiving Social Security or disability checks by mail must switch to electronic payments before the September 30th deadline, or risk losing access to their October benefits. This mandate, rooted in an executive order signed under President Trump, marks a pivotal shift in how benefits are distributed. For millions of seniors, especially those unfamiliar with digital banking,
backhand index pointing right. If this information helped you, don't stop here. Hit that subscribe button and turn on notifications so you're always one step ahead. We break down important updates like this clearly so you're never caught off guard. Join our community, stay informed, and take control of your financial future, starting today. Flexed Biceps Calendar.
The risk of missing a critical payment is real and fast approaching. Rose breaks down exactly what needs to be done, how to do it, and why delaying could result in serious financial setbacks. The situation is compounded by other key changes. Medicare premiums are rising, cost of living adjustments are projected to fall short, and new legislation like the Social Security Expansion Act and the so-called Big Beautiful Bill may reshape the benefits landscape. Yet many seniors won't qualify for the proposed $6,000 tax credit due to income limits. Rose emphasizes the importance of taking action now, updating payment methods, understanding what's in these bills, and preparing for enrollment season, to avoid costly oversights. Staying informed isn't optional anymore. It's essential for anyone relying on Social Security to maintain financial stability into the new year. If you're receiving Social Security or disability benefits, you need to take action before January 1st. This isn't optional. It's not something to think about later. It's urgent, and it directly affects whether you get your money on time. Let's start with the most important update. Paper checks are going away. Thanks to an executive order signed during the Trump administration, the government is mandating that all federal benefit payments be made electronically. This change is official, and the deadline is September 30th. That means if you're still getting paper checks, you need to switch to either direct deposit or the Direct Express debit card immediately. Failure to do this could result in you missing your payment, especially the upcoming October benefit check. This is not about speculation, this is about how the system now works. The U.S. Treasury will no longer be mailing checks after the deadline. So unless you enroll in electronic payments, your money could be delayed. Rose, a government benefits expert with over 15 years of experience, lays out exactly how to handle this transition. She breaks it down clearly. Go to the Go Direct website, call the official numbers listed on the Social Security or Treasury websites, or complete the proper enrollment forms to switch to electronic payments. You'll need basic information, your routing number, account number, or, if you choose Direct Express, your Social Security number and ID to set up the card. It's a simple process, but you need to do it now. Not next week, not next month. If you're helping a senior or someone on disability benefits, make sure they understand what's happening. Because after September 30th, paper checks are done. Now, there's another key issue that affects your benefits in 2024 and beyond. The Social Security Expansion Act. This is legislation being pushed to give all Social Security recipients a $200 increase in benefits across the board, raise minimum benefits to 125% of the federal poverty line, and fix how the cost of living adjustments, COLA, are calculated. Why is this so important? Because the projected COLA for 2024 is only 2.7%. That's about $50 more per month, but it doesn't go far when Medicare premiums, prescription drugs, and basic living costs keep rising. This is why Rose is pushing seniors to support the Expansion Act. It's not just a bump in benefits, it's a structural change to how seniors are treated in this economy. Let's be clear. The COLA adjustment alone is not enough. Seniors are being squeezed by inflation, and while $50 more sounds nice, it's quickly eaten up by the latest Medicare premium hikes. This is exactly why legislative advocacy matters. If you want more than the bare minimum, if you want benefits that reflect real-world costs, you need to pay attention to these bills and support the ones that actually help. That brings us to the so-called Big Beautiful Bill, a proposed tax credit that sounds generous on paper, up to $6,000 for seniors. But here's the catch. You only qualify if your income is above $23,750 as a single filer or above $46,700 as a couple. That means the majority of lower-income seniors, especially those living solely on Social Security, do not qualify for this credit. Rose doesn't mince words. This is not a solution for most. If anything, it exposes the need for direct stimulus payments or benefit increases that actually reach the people who need help the most. This tax credit, while big in name, leaves out too many seniors who are already struggling to keep the lights on. Instead of targeted tax relief based on high income thresholds, what's needed are universal solutions, like raising the benefit floor, expanding SSI, and indexing COLA to actual costs faced by seniors. And now let's talk about Medicare, because this is where things get really tight financially. Medicare open enrollment season is active, and premiums are increasing. Deductibles are going up. Plan options are changing. If you don't review your plan now, you could end up paying more for less coverage. Rose warns that too many seniors auto-renew their plans without realizing what's changed. If your medications aren't covered the same way, or your doctor is no longer in network, you could be hit with unexpected bills. So take the time to review your coverage. Check the updated premium charts. Understand what's included and what isn't. Because those rising healthcare costs are one of the biggest threats to retirement security. Again, this is about urgency. If you act now, you can avoid disruptions. If you wait, the consequences could be real. Missed checks, higher bills, and no clear path forward. Rose is also urging seniors to stay connected and informed. She runs a text alert service for real-time updates on Social Security, Medicare, Medicaid, and key legislation. These alerts include deadlines, benefit changes, and urgent policy developments. This isn't about fear. It's about staying one step ahead. The system is complex. The rules change. But with the right information at the right time, you can protect what you've earned. And let's not forget, income verification errors, missing documentation, or outdated account information can all lead to benefit disruptions. That's why Rose emphasizes reviewing your files, confirming your payment details, and ensuring everything is up to date before January 1st. The beginning of the year is when most changes take effect. COLA increases, Medicare premium shifts, and policy rollouts. If your paperwork isn't squared away, you could fall through the cracks. So what do you need to do before January 1st? Enroll in electronic payments if you haven't already. Review your Medicare plan during open enrollment. Monitor legislative updates, especially regarding the Expansion Act. Verify your Social Security information and payment method. Understand your eligibility for tax credits or relief programs, and whether they actually apply to your income bracket. And if you're unsure about any of it, contact your local Social Security office or a certified Medicare counselor. These departments exist to help you navigate the system, but they can't help if you don't reach out. Proactive steps now will save you from financial stress later. That's the bottom line. And don't just do it for yourself. Share this with someone who might not be getting the right information. Seniors in your family. A neighbor who still gets a paper check. A friend who doesn't know about the Expansion Act or the upcoming changes to Medicare. We're all going through this together, but the ones who prepare are the ones who stay secure. So if this helped you understand what's at stake, like this video, share it, and subscribe for more updates on Social Security, Medicare, and federal benefits that matter to you. We'll keep giving you the real facts with no fluff, just what you need to stay informed, empowered, and protected. If you're one of the millions of Americans still receiving your Social Security SSDI or SSI check by mail, you are now at serious risk of missing your payment. That's not an exaggeration. Starting September 30th, paper checks will no longer be issued for federal benefit payments. That means if you haven't made the switch to electronic payments, either through direct deposit or the Direct Express debit card, you could face a delay in receiving the money you rely on to survive. This change is not optional. It was signed into action by an executive order under President Trump, and it's happening. Period. You won't be grandfathered in. You won't get a grace period. The system is changing and the clock is ticking. Now, there's a real concern here, and Rose, with 15 years of experience in government benefits, has made it crystal clear. A huge number of seniors haven't switched yet. They've heard about the deadline but they're putting it off. Or they're confused by the process. Or they don't trust electronic systems. And some just don't know what to do. So let's make it simple. If you don't act now, your October check could be the last one you see on time. After that, if your payment method isn't electronic, it's going to get held up. It will not be mailed. That's not a threat. It's just the new rule. The good news is that switching over is not difficult. You can go through the GoDirect website, where you'll be asked to provide your social security number and either a bank account for direct deposit, or information to set up a Direct Express debit card. You can also call the numbers provided by the Social Security Administration or the Treasury Department to enroll over the phone. But you have to initiate the process. No one is going to do it for you. If you have a family member, a neighbor, or a friend who's older and may not be tech-savvy, help them get this done. Walk them through it. Because once October hits, the government is flipping the switch. Electronic only, no exceptions. And while you're dealing with that transition, there's more to prepare for. The 2024 COLA. The cost of living adjustment is expected to be around 2.7% this year. That's about a $50 monthly increase for the average retiree. It sounds helpful until you compare it to what's happening with Medicare premiums, groceries, gas, and utilities. So while you're getting $50 more, you might be spending $80 more. That's why so many advocates, including Rose, are calling for real reform, not just incremental increases that barely keep pace with inflation. That brings us to the Social Security Expansion Act. This bill, if passed, would provide a $200 increase across all Social Security recipients, raise the minimum benefit to 125% of the federal poverty level, and revise how COLA is calculated, using an index that actually reflects senior spending, not just the general economy. In plain terms, it would put more money into the pockets of seniors and adjust benefits based on real costs, like prescription drugs, heating bills, and insurance premiums. But here's the catch. It hasn't passed yet. And it won't unless there's enough public pressure behind it. That's why Rose is urging viewers not just to be informed, but to advocate. Contact your lawmakers. Call their offices. Let them know this bill matters. Because the reality is, most people in Washington aren't living on $1,200 a month in Social Security. They don't understand what it's like to choose between medication and groceries. But your voice can change that if you use it. Now, while this Expansion Act could help millions, another proposal, the Big Beautiful Bill, is getting attention for all the wrong reasons. It offers a $6,000 tax credit for seniors. Sounds generous, right? But here's the problem. It's only available to individuals making more than $23,750 and couples earning more than $46,700. That means the majority of low-income seniors, the ones who need help the most, are completely excluded. It's a benefit for wealthier seniors, not those living solely on Social Security. Rose makes the point clearly. This isn't meaningful relief. For most recipients, it does absolutely nothing. What's needed instead are direct stimulus checks or broader benefits that don't discriminate based on income thresholds that ignore the reality of fixed incomes. So while politicians celebrate a flashy number, $6,000, most people won't see a dime. That's not real help. That's a headline. On top of all of this, we're now in Medicare open enrollment season. And this year there are significant changes. Premiums are going up. Deductibles are going up. Out-of-pocket maximums are increasing. And if you don't check your plan, you could be hit with costs you weren't expecting. Plans that covered your prescriptions last year might not this year. Your primary care provider could be dropped. Your coverage for dental or vision might be reduced, or gone entirely. So take the time to review your plan. Use Medicare's Plan Finder tool. Call your local state health insurance assistance program, SHIP. They'll walk you through your options. Don't just auto-renew without looking, because the consequences could be costly. Rose is also reminding people that this is the season where scams spike. People pretending to be Medicare agents, calling seniors and asking for banking information, Social Security numbers, or offering discounts in exchange for personal data. Here's the rule. Medicare will never call you to ask for personal details. Ever. If someone calls claiming to be from Medicare, hang up and call the official Medicare number to verify. So here's your checklist before January 1st. If you're still getting paper checks, enroll in Direct Deposit or Direct Express now. If you've already enrolled, double-check your account info to ensure everything's current. Review your Medicare plan. Know your new premiums, deductibles, and provider networks. Watch for COLA updates and how they'll affect your benefit in January. Stay informed about the Social Security Expansion Act, and push your representatives to act. Understand that the big beautiful bill likely doesn't help you unless your income is above the qualifying threshold. Be cautious of scams, especially those asking for sensitive information by phone or email. And if you're overwhelmed, contact your local SSA or SHIP office for help. That's what they're there for. Everything is changing: payment systems, benefits, premiums, legislation. And the people who thrive are the ones who stay ahead of the change, not the ones who wait until it hits them in the wallet. If you rely on Social Security, SSI, or SSDI, you already know what it's like to live on a tight budget. There is no margin for error. Every dollar matters. So when the government says, you must switch to electronic payments by September 30th, that's not just a procedural notice. It's a financial emergency if you don't act. And even though the changeover date is September 30th, the impact will start showing up in October, which makes January 1st the absolute final line in the sand. Why? Because October's payment will already be processed under the new rules. If your method of payment isn't updated by then, your check won't come, and that disruption can create a domino effect of unpaid bills, missed rent, overdraft fees, and even utility shutoffs. This is especially true for seniors who live alone, or for people who don't have regular access to the internet. A missed payment isn't just a delay. It can spiral into something far worse. So again, if you know someone still getting paper checks, talk to them today. Make sure they understand this is mandatory, and it's happening whether they're ready or not. And there's another issue tied directly to this: the need for accurate, up-to-date banking information. Even if you already have electronic payments set up, verify your account details. Closed bank account, an old routing number, typo in your information. Any of these can trigger a rejected payment. And now, under the new system, correcting those errors will take longer than it did before. That's why Rose is pushing this message so hard. She's seen how even small mistakes, things as simple as switching banks or forgetting to update your account, can lead to benefits being held up for weeks. And when that check is your only income, weeks feel like forever. So let's be crystal clear. If you haven't enrolled in Direct Deposit or Direct Express, or if you're unsure about whether your payment information is correct, do it now. Don't wait for the system to reject your next check. Fix it before it breaks. While we're on the topic of planning, let's come back to Medicare open enrollment, because this is another area where small oversights can lead to big losses. Every year, thousands of seniors stick with their Medicare Advantage plan or prescription drug plan without reviewing the changes. They assume it'll be the same as last year. And then January hits, and their new prescription isn't covered. Their specialist is out of network. Their copays have tripled. And by then, it's too late. Open enrollment is your only chance to switch, compare, and optimize your plan. If you're not sure how to navigate it, reach out to a state health insurance assistance program in your area. These are free, government-funded advisors, not insurance salespeople, who will walk you through your coverage options step by step. Rose is seeing this happen everywhere. Seniors getting hit with higher premiums, reduced coverage, or surprise bills just because they didn't take the time to look. Don't let that be you. Check your plan. Compare your options. Make sure you're not losing money or benefits by default. And here's a detail most people overlook. If your Medicare premium goes up, it reduces the net benefit of your Social Security COLA increase. Let's say your COLA gives you an extra $50 per month. But your Medicare premium rises by $35. What's left? Just $15 in your pocket, if you're lucky. That's why Rose and so many advocates are saying the 2.7% COLA isn't enough. Because it's eaten up by healthcare inflation before it ever reaches your wallet. That's also why the Social Security Expansion Act is so important. A flat $200 increase across the board would provide real relief, not a symbolic bump. And raising the minimum benefit to 125% of the poverty level. That would change lives for people currently getting less than $1,000 a month. But this won't pass on its own. Congress doesn't just wake up and decide to help seniors. They respond to pressure. That means calls, letters, and emails. That means showing up to town halls and making your voice heard. If you want more than crumbs, if you want policy that actually reflects the cost of living, you have to speak up. And Rose isn't just talking to one group. She's talking to all seniors. Urban, rural, conservative, progressive, it doesn't matter. Because inflation doesn't care who you voted for. Rising costs are hitting everyone, and Social Security is the safety net that millions depend on. That's why she's also been critical of the big beautiful bill. Because while it promises a flashy $6,000 tax credit, it excludes most low-income seniors. It only helps those making over $23,750 as a single person, or $46,700 as a couple. If you're living on Social Security alone, you probably don't qualify, which means this bill does nothing for you. And let's be honest, if you're already struggling to make ends meet, a tax credit is not the same as a direct payment. It doesn't show up in your bank account every month. You can't use it to buy groceries or cover rent. That's why so many seniors are pushing back. Because what's being presented as relief is actually just a tax break for people who already have more. Rose is calling for direct stimulus payments instead. Payments that go to the people who need them most. The ones paying more for medicine, electricity, rent, and food than ever before. The ones for whom $200 a month isn't just helpful. It's the difference between staying afloat and falling behind. And that's what this entire conversation boils down to. Staying ahead, staying informed, and staying protected. If you're on benefits, you can't afford to be passive. Too many things are changing. The payment system, the COLA, the cost of Medicare, the legislative landscape. And if you don't stay on top of it, you're the one who loses. Not the politicians, not the agencies. So before January 1st, here's what needs to happen. Switch to electronic payments if you haven't already. Use direct deposit or direct express. Verify your banking information. Don't assume it's correct. Review your Medicare coverage during open enrollment. Monitor how your COLA increase will interact with your new Medicare premium. Push for passage of the Social Security Expansion Act. Understand the limitations of the big beautiful bill. Sign up for reliable real-time updates from sources like Rose. Report scams immediately. And never give your personal info to unsolicited callers. Contact Social Security or Medicare offices directly for official help. Don't rely on hearsay or third parties. This is your income, your healthcare, your safety net. It's up to you to protect it. And if this message helped you, hit the like button, share this video, and subscribe so you're never caught off guard again. Because no one's going to knock on your door with a checklist of what to do next. But we will be here to make sure you know exactly what's coming and how to handle it. Stay alert, stay informed, and take care of your future.